So continuing our lecture on PNF, we have seen about the resistance, we have seen about irradiation, reinforcement, we have seen about the manual contact. Also, we discussed about the body position, body mechanics, and verbal commands with vision. Now that we want to discuss is more of traction and approximation. As the name suggests, as we had described in the last lecture, you can see the last video also. In that we already have described what is traction. So traction is moving apart and approximation is moving within or towards each other. Yes. So that is the main difference between traction and approximation. First we'll talk about in general and then we are specifically going to talk about traction and then specifically for approximation. Yes. So for traction, the therapeutic effects of traction and approximation is due to stimulation of joint receptors. Now as we had already described, joint receptors એટલે કે એવા receptors જે તમને joint sense આપશે હોય ક્યાં capsuleમાં, that is capsule is located within the joint and on the articulating surfaces. Yes, if this is a joint formed by one articulating surface and second articulating surface, when they are formed, there on this surface there will be proprioceptors, special receptors which sense the sense of proprioception. When they are sensing the sense, if we try to move it towards it, proprioceptors will get excited. Yes, and there will be more improved amount of you can say strength. How? We are going to see again the same mechanics. Sensory input will lead to alpha motor neuron excitation through interneuron and will lead to contraction, forceful contraction of the muscles. The same mechanism we are going to discuss that we have already seen. Traction is applied when the movement is occurring against the gravity and approximation when the movement occurs in the direction of gravitational pull. If we talk about shoulder joint, if we want to provide traction, it is in opposite side to the movement or the gravitational pull. So gravitational pull is downwards. Opposite to that, yes, so you will move the humerus upwards and inwards towards the scapula, glenoid cavity. Yes, head of the humerus to be pushed within the joint. That is against gravity, and approximation is towards the gravity. So if you pull it down, that is moving both the bones apart, that is approximation. Same thing when you are moving the joint into traction, specifically you will be moving the part, and because of the sensory input there will be excitation of alpha motor neuron, that is interneuron will give sense to alpha motor neuron to contract the muscle more and more. So joint, you can see giving signals. After that, excitation of interneuron leading to alpha motor neuron excitation and leading to muscle contraction. Yes, contraction of the muscle. Traction is elongation of the trunk or an extremity. Traction force is applied gradually, maintained throughout the range of motion. When you are providing traction, you need to take into consideration that maximum amount of force that you are applying is maintained throughout the range of motion. Say for example, you ask the patient to do wrist extension. After wrist extension કરવું છે. Yes, when you are asking the patient to do wrist extension, at that time you are providing some amount of traction, that is pulling apart. When you are trying to pull it apart and at the same time you have to maintain this force. આ force maintain કરવાનો છે. તમે traction provide કરો છો. One hand will be stabilizing that part and second will be providing traction. આ force provide કરશે. Yes. Maintain this throughout the range of motion when the patient is performing activity. Yes, that is the main aim. કે આપણે એ આખા રેન્જમાં મેન્ટેન કરવાનું છે. Utmost important. Joint separation stimulates joint receptors. Muscle stretches stimulates the muscle spindle receptors and facilitates alpha motor neuron, which facilitates the strength. The same thing. Joint receptors stimulating directly, moving it to the interneuron, moving to the alpha motor neuron, and stretching. Rather I would say strengthening purpose.
What does causative
Please. Uses facilitation motion, especially pulling and anti-gravity motion, aid in elongation of muscle tissue when using the stretch reflex. Stretch reflex we have already described in stretching. When you move the fibers so fast or to a limit, range of motion, extreme range of motion, or both speed માં આપણે movement કરવાની try કરી, at that time GTO gets stimulated, and because of this alpha motor neuron gives stimulation, that muscle should contract. Yes, so that is the stretch reflex. So in stretch reflex specifically if you are using, that will help in the elongation of the muscle tissue. Same principle as in stretching. Facilitate the motion, especially pulling and anti-gravity muscles, and resist some part of the motion. Example, use traction at the beginning of the shoulder flexion to resist scapular elevation. So here more specifically we are talking about, initially we can provide traction in a range, and through this traction that we are going to provide, there will be resisted motions. or we can say trick movements of the shoulder joint. Say for example, I'm not able to move the hand into abduction. Yes, my abductors are weak, middle deltoid is weak. So for that reason, what will I do? I do trunk flexion, lateral flexion on one side. Yes, and with that, initially I can initiate the movement. But if I'm resisting or I'm providing traction at the beginning of the shoulder joint, beginning of the range, at that time I can prevent this scapular elevation also, or trunk lateral flexion. Yes, so that is one of the use of traction. Approximation, as the name suggests, we are approximating compression of the trunk or an extremity. Trunk or extremity, here we are specifically talking about one joint. So the articulating surfaces will be compressed, that is brought together. Compression through a joint stimulates the joint receptors. Again, when they are moving forward, moving towards each other, they will be stimulated. Which again, the same principle facilitate the alpha motor neuron and facilitate the stability or improve the strength. Promote stabilization. Yes, whenever you are pulling it apart, when you are providing traction, it is you are trying to dislocate or subluxate the joint. But when you are pushing it towards each other, that means you are trying to promote stabilization. The joint will become more stable. Facilitate weight bearing and contraction of postural muscles, specifically used for postural muscles and anti-gravity muscles. Specifically, we try to go for approximation. Facilitate the upright reactions. Resist some components of the motion. Example, use approximation at the end of shoulder flexion to resist scapular elevation. Now, as you already know, to complete the range of motion, say for example abduction or flexion, yes, elevation activities of the shoulder, when you want to complete the range, some amount of what is also known as glenohumeral rhythm, you need movement of the scapula along with that. Yes, so you have to promote the stability of the scapula, glenoid cavity, and head of the humerus in this. Yes, so whenever the head of the humerus is moving, scapula also needs to tilt a bit so that it can complete the 180-degree range of motion. So for that, initially we are not providing any approximation. In the end range, we are providing approximation so that scapula is more stabilized and end range can be achieved very easily. There are two ways to apply the approximation. Traction we saw can be applied in the starting and maintained throughout the range of motion. Here there are two ways for approximation. The first is quick approximation, second is opposite, that is slow approximation. As the name itself suggests, quick approximation is the force applied quickly to elicit a stress reflex type response. Say for example, approximation given quickly. I am just providing approximation quickly, that will create a stretch reflex type of reaction. Slow approximation, that is for maintaining throughout the range of motion. So the force is applied gradually up to the patient's tolerance. So you start slowly, give approximation, give approximation, give approximation, and ask the patient to do active movement. May that be individual movement, may that be in patterns. We are going to see the patterns today itself probably. Yes. Approximation is always maintained whether done quickly or slowly. So if you are doing initially, if it is very quick, you cannot maintain it, but if you are doing it slowly, you have to maintain it throughout the range of motion. When the therapist feels that the active muscle contraction decreases, the approximation is repeated and resistance is given. Approximation, you can say, is something when you feel that the power is not enough, the muscle is not acting as much as you wanted, જે strength તમારે જોઈ છે એ નથી આવતી એમાંથી. At that time, you try moving the part into approximation as much as possible. Yes. So, say for example, it has started, the action has started. Here you feel the muscle is lacking or is weak. So here you try approximating and then you ask the patient to do the movement again. So when you ask the patient to do the movement again, you will feel the muscle contraction has increased. Why? Because of the joint approximation, interneuron, alpha motor neuron directly stimulating the muscle. So through this reflex, directly it will increase the force of contraction of the muscle. Moving to stretch. Now to stretch, as you are all aware directly, for stretching we do opposite action of what is required. Yes, say for example biceps. Biceps action is elbow flexion. We are not concerned with shoulder at this moment. We are considering biceps here for the example purpose as one joint muscle. So for elbow flexion, whenever you are asking the patient to do, at that time, if you want to stretch the biceps, what do? You do opposite of it. So how do you do opposite? Elbow extension. So whenever the patient is trying to move the hand into flexion, you will apply so much high force that the biceps will go for extension. Yes, or you can say elbow will go for extension and bicep will be stretched. When the bicep is stretched, તો શું થશે? Bicep stretch reflects through forcefully contract કરશે. એટલે તમે જેમ stretch apply કરશો, stretch reflects through વધારે forceful contraction જોવા મળશે. Yes, this is the basic principle on which the stretch works. The stretch stimulus occurs when the muscle is elongated. So, action of biceps, elbow flexion. I am holding it continuously and pushing it. Yes, patient શું try કરે છે elbow flex કરવાની. As a therapist, I am opposing the motion. Yes, resistance, opposing it. And I am providing so much force, the hand moves into extension. The London position of the muscle is the starting position of each pattern and the stretch is maintained throughout the movement. Now, talking to the patterns, one of the movements that we already know, this pattern. Yes. So this pattern, this is the starting position. So here you can see which all muscles are elongated. You start from the fingers. So finger flexors, wrist flexors, elbow extends flexors, as well as you can see shoulder. Yes, shoulder adductors and extensors. They were also under stretch force. So this is the starting position. This will be the end position, completely opposite. So this is also one of the starting position for the another pattern. Yes, એક પેટર્ન એન્ડ થશે એ બીજાની સ્ટાર્ટિંગ પોઝિશન કહેવાય. યસ, હાઉ? Do not get confused. We are going to see in the upcoming slides. It will be much more clear to you then. All the components of a pattern must be stretched simultaneously. So your hand placement, manual contact should be as such. તમારે stretch apply કરવો છે, resistance apply કરવો છે. Anything that you want to give therapeutically, you have to have your hands directly over that part so that you can move and apply the resistance or the stretch directly without changing your hand positions. Yes, that is why manual contact is at most important. What will be the effect? Stimulates the activity of the muscle spindle. Any contraction of the muscle on stretch will result in movement, and the brain knows not of muscles but of movement. Utmost important, if you remember this, our brain does not recognize which are the wrist flexors, wrist extensors. No, it recognizes only and only one thing, that is movement. Yes, if I want to make fist, my brain does not send signal to flexor digitorum or flexor palpi alvaris or any muscle. They are just sending signal for one thing, that is make a fist. Yes, muscles brain ne yaad na rahe. It is always the movement that the brain remembers. Yes, you want to do shoulder flexion, you will do shoulder flexion. You will do shoulder abduction, you will do shoulder abduction. Brain એમ સિગ્નલ ના આપે biceps ને or deltoid ને, you have to contract to do this movement. It will only give proper neural, you can say, symmetry so that it can cause specific muscle action. Yes, but our brain always remembers the movement, not the muscle. So again, the same thing, giving muscle spindle. If you are moving too fast or you are extending towards end range, that is terminal range of motion, at that time muscle spindle gets excited, gives to the interneuron gives signal to the alpha motor neuron, and there is muscle contraction. Yes, the same thing that you are learning. PNF specifically works from spinal cord level reflexes. That is the most important thing you should remember. So muscle spindles giving signals to interneuron, alpha motor neuron getting excited, and there will be muscle contraction. Uses. Where can stretching be used? Yes, so can be used to initiate voluntary movement. Say for example, stretch reflex. As the name itself suggests, is a reflex. એમાં patient voluntarily કાંઈ નથી કરી શકતું. So for that reason, it is a reflex. So say for example, this hand is completely paralyzed. Yes, my wrist flexors are completely paralyzed, wrist extensors are completely paralyzed. Yes, so what can I do? I will just move the part rapidly into extension. Yes, I am moving to the end range as well as with speed. So શું થશે? Muscle spindle activate થશે, interneuron પાસે જશે, alpha motor neuron muscle contraction કરાવશે. Paralyzed છે તો પણ muscle contract કરશે. Why? Because of reflex. So reflex is involuntary. It cannot be done. Yes, voluntarily હું reflex ના કરી શકું. Yes, it is involuntary. You just need sensory stimuli. The sensory stimuli is this right now. Yes, moving the hand into extension. Fast extension till the terminal range. So that will stimulate the muscle spindle. Muscle spindle through the interneuron will cause the muscle contraction. Muscle contract thase. Yes. So to initiate when the patient is completely paralyzed, not able to do, or the muscle is very weak, at that time you can start with stretching. The patient is instructed to coincide with the reflex movement brought about by the therapist. Now, whenever you are doing this, આપણે આ example continue કરીએ. Moving the hand into extension and moving reflexly શું થશે? Flexion થશે. Yes, you are moving or stretching the wrist flexors, moving the hand into wrist extension. Stretch કર્યું અને patient જોશે voluntarily નહીં પણ involuntarily because of reflex એના જાણ વગર એ movement થશે. Yes, so you will ask the patient, while this is happening, while the reflex is taking place, patient has to voluntarily try to do it. Yes, and that is how voluntary control, motor control develops. Can also be used to aid the response of weak muscles. As we talk, paralyzed muscle or weak muscles, બંને માટે same procedure can be used. So here you need to know which muscle is weak and also how to stretch that muscle. If I ask you, you have to stretch TFL or IT band. Yes, you should know what is the position, what is the origin insertion. That is why the assignment has been given for anatomy. Used to obtain lengthening reaction of hypertonic muscles. Now, hypertonic muscles, that is muscles who have more tone, increased tone. Say, for example, spasticity. What is spasticity? Spasticity is nothing but increased muscle tone, which you feel like catch and release. That is, કંઈક તમને રેઝિસ્ટન્સ ફીલ થાય અને વયું જાય throughout the range of motion when you are performing fast passive movement. ફાસ્ટ પેસિવ મુવમેન્ટ જ્યારે પણ કોઈ લિમ્બની તમારે સ્પાસ્ટિસિટી ઓર મસલ ટોન ચેક કરવું હોય તો શું કરવાનું એનું ફાસ્ટ પેસિવ મુવમેન્ટ કરવાનું યસ my left hand is affected, right hand is therapist hand, and I'm trying to move it as much as possible fast. Yes, if I feel resistance, say for example I'm doing, I feel અહીંયા resistance આવે છે ને અહીંયા વયું જાય છે, અહીંયા આવે છે અહીંયા વયું જાય, so this is catch and release. Yes, this is catch and release. I am trying to move, the therapist is trying to move. Passively overstretch reflex ના લીધે આ તમને resistance feel થાય છે વચ્ચે, ક્યાંક resistance આવે છે અને વયું જાય છે. Yes, so that's range. That is, the patient is having spasticity. For that, you can apply stretching. Stretching in the sense slow stretching. આમાં slow stretching વધારે કામ લાગશે because fast passive movement થી stretch reflex elicit થાય છે. તો એને inhibit કરવા માટે slow stretching or prolonged stretching આપવું પડશે. By simulating a contraction of opposing muscle group, the hypertonic muscle will reciprocally lengthen. By reflexly stimulating a contraction of hypertonic group, this contraction will be followed by relaxation phase. Coming to our two main terms, autogenic inhibition, reciprocal inhibition, that we have learned in stretching. Autogenic inhibition means you are trying to contract the same muscle. After a forceful contraction, there will be relaxation. Yes, so stretch reflex through and stimulate karo. Yes, I am moving this part. Say for example, આ weak આ muscle માં spasticity છે, મને feel થાય છે કે આમાં spasticity છે. Yes, now I am trying to move the part into stretching. Stretch reflex આવશે તો forceful contraction આવશે. After forceful contraction, there will be relaxation. Yes, so this is autogenic inhibition. Second, reciprocal inhibition or reciprocal innervation, when I am trying to move the opposite triceps ne, or you can say wrist extensors ne. If it is elbow joint, then it will be triceps. If we are doing extensors of the wrist, it will be wrist extensors. So wrist extensors, if I am trying to contract, there will be contraction of wrist extensors. Yes, wrist extensors ne stretch karu, moving it into completely flexion. Yes, તો શું થશે? It will cause wrist extension. Wrist extension થશે. રેસિપ્રોકલ ઇન્હિબિશન ના લો થી જો મૂવમેન્ટ આ થઈ તો એના ઓપોઝિટ એન્ટાગોનિસ્ટ રિલેક્સ થવા જોઈએ. Yes, so that is reciprocal inhibition. So both can be applied. You can stretch the same muscle or opposite muscle to decrease the tone. That is hypertonic muscle group. Okay, last that we will discuss is timing. Timing is also very important. At what time you are going to give commands, at what time you are going to start, and in what time it should be completed. Everything takes a very important role in providing PNF. So timing is the sequencing of motion. આ મોશન આપણે જે કરતા હતા પેટર્ન, યસ, તો એમાં પહેલા આટલું જ થવું જોઈએ, પછી આ રિસ્ટ મૂવમેન્ટ, પછી એલ્બો મૂવમેન્ટ, and then there will be shoulder motion. Again shoulder motion, elbow motion, wrist and fingers. Yes, so this is all dependent on the commands that you are providing, visual contact and also the timing. Normal timing of most coordinated and efficient motion is from distal to proximal. So from the starting, I am telling you this from the starting. Yes, પહેલા fingers નું કરશું, પછી wrist નું, પછી elbow and then shoulders. So you always start from distal, that is fingers, to proximal, that is your shoulder joint, or even sometimes even trunk. Trunk PNF is also one of the things. Timing for emphasis involves changing the normal sequencing of motion to emphasize a particular muscle or desired activity. Now timing, say for example આપણે start કર્યું, પહેલા મેં finger start કર્યા, પછી wrist ને move કરું છું, પછી elbow. Now I see elbow are weak, elbow muscles, flexors and extensors weak છે compared to wrist. Yes, so I will do this again and again. આ જ action હું continue કરાવીશ patient પાસે. Yes, so that I will spend more time doing that to, we can say it is like you practice it more and more to become perfect. Yes, so the same thing, જે પણ muscle તમને લાગે lacking છે, જે પણ joint તમને લાગે કે ના this is not done, you need more practice of this, that action you will completely repeat again and again. Yes, so more time should be given to such muscle groups which are weak. There are two ways the therapist can alter the normal timing for therapeutic purpose: by preventing all motion in a pattern except the one that is to be emphasized, and by resisting an isometric or maintained contraction of strong motion in a pattern while exercising the other muscles. હવે બે રીતે આપણે ટાઈમિંગ ચેન્જ કરીએ. સે ફોર એક્ઝામ્પલ, સેમ એક્ઝામ્પલ we continue. Elbow, yes, flexors and extensors, they are not working properly, they are weak compared to wrist and the shoulder musculature. So you can do two things: either you don't move the wrist and the shoulder joint, you just try to move the elbow નું strengthening કરી શકાય, એમાં PNF techniques use કરી શકાય, or આખા પેટર્ન ને આપણે strengthen કરીએ એક સાથે પણ આમાં resistance વધારે આપીએ. Yes, so both are possible. Either you stabilize or you do not move, isometric contraction કરાવો for wrist and shoulder, or you can go for the whole motion training. આખા પેટર્નમાં આપણે ટ્રેનિંગ આપશું, but resistance should be increased at the desired movement or desired range of motion. Yes, so both are possible. Okay, patterns, I think we'll keep it for next lecture. Pattern, as well as then we are going to see about how patterns along with the whole procedure can be useful in applying the basic procedure of PNF and the technique specifically. Yes. Okay. Any doubts till now? Anyone has? Yes or no? Everyone in the chat. Okay. Fine, fine. Okay. So we'll keep it till here. In the next lecture, we'll be moving to patterns of PNF, at most important. If you know the patterns of PNF and you follow the basic procedures, techniques will be very easy to understand. Yes. Fine. Okay, have you taken the attendance?
Yes, sir.
Okay, fine. So we'll keep it in here. Tomorrow we'll continue with the same. Hope you have a good day. Be safe.